For some parents, certain duties aren't an option. We feed them, we clothe them, we try to make sure they are safe. But for some, vaccinating is not a duty, it's a
Well, I
choice.
first think that it's a parent's choice. My kids are vaccinated, so I think it's an important choice. Concerned, yes. Highly concerned, I wouldn't say so. I think it comes into play when there may be an outbreak or when there is cause for concern, like now in popular news.
Like the recent investigation into measles cases linked to a California amusement park. The controversy behind vaccinations doesn't just stem from a simple cold or flu. We're talking largely eradicated diseases such as measles and chickenpox. In 2015 alone, already 141 cases from 17 states have been reported. In 2014, a whopping 644 cases of measles were reported last year to the CDC. A discredited vaccination study linking autism to certain vaccinations spiked a recent distrust in vaccinating children and a debate on the risk of exposure.
As long as there are no epidemics or any of those preventable diseases that are going on, the risk is pretty minimal. And a lot of times the risk is minimal because everybody else is vaccinated. So the problem comes in when we do have like an epidemic or a sudden increase in some of these previously preventable diseases. Then these students are more, or their risk increases.
Alethea Russell, Tiger TV.
We don't inform other parents that, oh, there are other students who are in this school who are not vaccinated. Now, if there is an epidemic, then sometimes those laws, even though they're in place, if it's going to affect the whole public health, if it affects public health, then that may have to change as a result of if they think it's going to be a problem for students.
Can you explain the risk or origin of the current vaccination issue, or what caused this shift in a distrust or opting out of vaccination?
shift, I think, kind of started in opting out of vaccination, kind of started probably when this this physician in 1998 published a story in his journal saying that he had done research linking vaccinations to autism. Well, when that happened, everybody kind of just went crazy about it, whatever. Well, but what people may not know, the other part of that story is that that doctor was, none of his information was founded. They said that he had falsified some of the data that he received, and he ended up losing his medical license. But a lot of times parents don't hear that part of it, so they're thinking the big fear is that, oh, if I vaccinate my children, certain vaccines will cause autism. So that's kind of what I think has made that shift in distrust of vaccinations.
If non-vaccinations become more popular, will we expect to see changes in protocol or legislation for public school systems?
Well, whether it's popular or not, we may end up seeing changes in public school systems or in changes in vaccinations, but not based on the popularity of it, based mainly on scientific data. If they find more information, I mean, pretty much we know, it's been kind of proven that vaccinations save lives. Immunizations have been shown to decrease mortality due to the infectious disease and improve survival rates, and they increase the overall life expectancy during the 20th century. We've kind of seen that. So I think what's going to happen is we'll just continue to try to do research and do what best practices are. So there's a possibility that there'll be some changes. Actually, some schools have kind of gone to, and I think maybe jumping the gun a little bit. Some schools are kind of already looking at different policies based on research, and that may, some schools are trying to say, I mentioned earlier the exemptions where there are some religious and some medical exemptions. Well, some schools are looking at not, even accepting religious exemptions, and they're also requiring that medical providers give mainly kind of counseling to parents who are kind of thinking about opting out, and showing proof of that education that they've gotten. And then there are also some school systems are requiring that parents track and report the number of students who are not vaccinated, as a result of it. So there's a possibility that legislation will change, but I don't think it's going to have anything to do with whether it's popular or not. It's going to be based on research and evidence.
Do you have any data or health statistics that support vaccination or non-vaccination?
Yes. Well, we know that what I want to talk about first is like in the United States, 42,000 adults and 300 children die from some of these as a result of vaccine preventable diseases. So we know what can happen if these vaccines are not used. But vaccines have been shown to be 100% effective. The majority of the vaccines, now not all, there are some people who don't necessarily, the vaccines may not have worked well for them, but it's usually sometimes dealing with other health issues that these people have. But the majority of them, like 85% to 99% effective in preventing the diseases. So we know that. The data to support non-vaccination, has not been founded. That was that one study that was done. But we just know that some people the reason they're saying they're not using this for religious or philosophic beliefs. Some of them are just anti-government. They're believing that immunization status should be personal choice and the government shouldn't tell them what they need to do. And some people are worried about the vaccination safety and efficacy, which is kind of like the whole autism scare. And some people just kind of believe, it's a big deal. It's a big hype. It's really not that bad. You're not going to get these diseases, and it's really not that bad anymore. Some people believe that it's eradicated. I mean, and again, proof that vaccinations work was measles was eradicated. Like in 2000, we were thinking that there was no measles, and here we come 15 years later. I mean, since 2000, the measles have been eradicated, and now here we are, 2015, and it's coming back, and it's based on the fact that there are people coming in either who are not vaccinated or have visited other countries, and we're going to continue to see that because we live in a global world now. People in the United States are going to be traveling to other countries all the time. We have people coming in and out all the time, and some of those countries, I mean, they believe that if there are 90% of people who become vaccinated, that decreases the chances of a spread of an epidemic. So people are going to be traveling to countries where that's not the case.
That's all of them.
All right, I hope that was okay.
That was good.